anyone who is having diabetes for a long time is prone or is susceptible to develop gum disease. Patients don't take treatment in time, teeth may become loose and eventually the tooth may fall off. So this is one of the significant associations, one of the complications that is associated with a gum disease for a pregnant patient. It is considered as the 6th most important complication of diabetes.
Good evening, dear friends. This is Jessila Mujib welcoming you to a brand new episode of BMC Global Live Al-Hilal Health World, Nothing But Lifestyle. This is a talk show purely dedicated to your health-related queries and concerns. Today, the topic of discussion is the importance of gum health in diabetic patients and also in women. And the doctor joining us today is Dr. Sunil Kumar Denthumdas from Al-Hilal Hospital, Sitra Branch. He is a specialist periodontist with an experience of more than 17 years. So, Doctor, welcome to the show.
Thank you very much. Thank you for having me here.
So, Doctor, we have heard about complications, many complications of diabetes. Can we categorize the gum disease also as a complication of diabetes?
Yes. See, like previously you must have heard diabetic patients developing a lot of complications. What are the regular complications you would have heard of?
Yes.
Retinopathy, nephropathy, neuropathy, and vasculopathy or poor wound healing. These are the regular complications which have been established. In the last 10-15 years, the American Diabetic Association has also categorized gum disease as one of the complications of diabetes. It is considered as the 6th most important complication of diabetes, gum disease. So, anyone who is having diabetes for a long time is prone or is susceptible to develop gum disease. What happens when the gum disease develops? It can lead to bone loss and eventually patients may lose their teeth. So that is one of the most important complications of diabetes. Yes.
So, Doctor, how does diabetes affect our gum health? Can you explain?
Yes. Now, there are various pathways by which diabetes can lead to gum disease. Now, consider a diabetic patient is having excellent oral hygiene. Will he develop gum disease? No, he may not develop gum disease. But if the diabetic person is not having a proper oral hygiene, is not doing good brushing, and the food deposits are accumulating on the teeth and the bacterial deposits are accumulating on the teeth, it will lead to gum infection. So how does it differ from a normal person? Now, in diabetic patients, the immunity is compromised, the blood flow to the tissues is compromised. The gum tissues don't have that good resistance compared to a normal person's. So the gum tissues cannot fight bacterial infections so efficiently that the gum tissues in a healthy person can resist the bacterial infections. So whenever a gum infection develops in a diabetic patient, there is easy entry of the bacteria into the tissues and they can cause a lot of damage to the gum tissues. Now, in diabetic patients, the immunity is a sort of compromised. When you compare it to a normal person, the white blood cells, which are the mainly defense cells for the body, they can fight the bacteria or viruses and eliminate the infection from the body, or they can prevent the spread of infection. But what happens in a diabetic patient? These WBCs, mainly the neutrophils, which are the primary responders, they move slowly, they don't move fast, and they don't fight against the bacteria so well. So what happens is the bacteria gain an easy entry into the gum tissues in diabetic patients, and they can spread fast to the bone. They can cause a lot of bone destruction, and eventually, if it's not controlled, if the patients don't take treatment in time, teeth may become loose and eventually the tooth may fall off. So this is how gum disease can develop and spread faster in a diabetic patient.
Now you spoke about how diabetes affects the gum health. Now, will the gum disease cause the fluctuations in blood sugar levels?
Of course, in the last 10-15 years, a lot of research has been being done. Whether gum infections, whether oral infections or gum infections in particular, can affect the blood sugar level in people, or particularly diabetic patients. And studies have found that indeed patients having gum infections, they can definitely affect the blood sugar level in people. Now, how does this happen? The bacteria and the bacterial products or the inflammatory products that are present in the gum disease, they can enter the blood circulation. Now, what happens when these inflammatory products and the bacteria enter the blood circulation? They increase the resistance of the cells to insulin. Now, what does insulin do? It helps in the transport of glucose from the blood into the cell. Now, suppose we have this building over here. Okay, there's a gate for the people to enter inside, the cars to enter inside. If someone is blocking the entry, how can the cars enter? So someone has dumped something over there. You can't enter. easily. So similarly, when the bacterial products or inflammatory mediators, inflammatory products enter into circulation, they block the entry of the insulin easily into the cell. So when the insulin cannot enter the cell, the glucose cannot enter the cell also. So that means the cell's resistance is increased to the entry of insulin. Because of this, the blood glucose level rises. This is how the infection, not only gum infection, any infection anywhere in the body, it can contribute to increase in blood sugar level. So now they have done research on this, because gum infection is a chronic condition. It must be there, it can be there for 5 years, 10 years, 15 years. So for such a chronic condition, if the inflammation is there, these inflammatory mediators, molecules, when they enter the circulation, they increase the resistance of the cells to insulin, and that way they increase the blood glucose level. So for patients having diabetes, having a gum infection, associated gum infection, it becomes difficult for them to control the blood glucose level. And people who are at risk for developing diabetes, or who are in the pre-diabetic stage, they can easily develop diabetes. And people who are already taking medications, they may have to take increase amount of higher dosage of anti-diabetic medications for the insulin to enter into the blood cells. This is the risk that is associated with gum infection. This is how gum infection can lead to an uncontrolled blood glucose level, and also can lead to development of diabetes.
So how often should a person with diabetes visit a dentist to check his gum health?
Usually, if a diabetes has got good, a diabetic person has got good oral health, maintaining good oral hygiene, everything, twice in a year would be sufficient. But if a same diabetic patient has got severe gum infections, then we would recommend to visit the dentist or a periodontist every 3 to 4 months to see that the gum health is kept under check. Gum infection is kept under check, and proper treatment is given in time.
So what is the role of physicians and other family members to control the diabetes?
Physicians play a very important role. Now, whenever a diabetic patient is going to the hospital, definitely he is going to visit a physician to control his blood glucose. He is not going to visit a dentist. But it is the physician who should be knowing that a diabetic patient can have oral problems also, gum problems also, which may be affecting the blood glucose levels. So it is up to the physician to ask about the oral condition of the patient, diabetic patient, and motivate the patient to visit a dentist or a periodontist to get an oral screening done. And if necessary, if there is any gum infection, to get it treated so that the blood glucose levels can be normalized. And what is the importance of the family members? Now, the family members, the importance is that they have to motivate their loved ones who have diabetes to go for dental checkups, frequent dental checkups. And they also have to motivate these diabetic people to maintain proper oral hygiene at home. That is the importance of the physician and family members.
Now, doctor, moving on to another group, women. Are women more susceptible to gum infection than men?
The answer is yes as well as no. No, why? Because when you compare women and men, if both the groups of people are not brushing well, it can cause gum infection. But there is something in women which happens, which is called as hormonal fluctuations. Men do not have that hormonal fluctuations. So when a hormonal fluctuations changes happen in women, it makes them at that particular stage more vulnerable or susceptible to development of gum infection, and also they can spread more faster. So that is the only difference. So when the hormonal changes are happening in women, hormonal surge is happening in women, they will be more susceptible to develop the gum infections. That's the difference.
Now, doctor, you spoke about the hormonal fluctuations in women. So when young girls attain puberty, they are going through a lot of hormonal changes.
Yeah.
So do they have the chance of gum infections?
Yes. So likewise, like I told initially, if a person is maintaining good oral hygiene, they don't have the chance of developing any gum infection. But if you tend to neglect your oral, if you're not brushing well, there is always a chance of developing gum infection for anyone. So now for women, now we can discuss under 3 headings: women at the stage of puberty, women in pregnancy, and women after menopause. So when women are undergoing attaining puberty, girls are attaining puberty, we know that there's a hormonal surge happening in the body. What happens when these hormones, mainly the progesterone and estrogen, these hormones, when the levels suddenly, the surge increases, the blood flow to the gum tissues increases. Okay, so when there's so much of blood flow to the gums become very sensitive. So you see that with even minimal amount of food deposits or bacterial deposits on the teeth, it can initiate a very strong reaction from the gums. So you see that for girls undergoing puberty, if there is a mild amount of food deposits which is causing inflammation, you will see that the gums are very red, so very much swollen. and there's a lot of bleeding. Easily it bleeds. Compared to the same amount of bacterial deposit, if you see in a boy, young boy, he will not have so much of inflammation. Same amount of bacterial deposit, if he's not brushing, that same level of brushing is there in a boy, you may not see so much of inflammation. But the same age group girl who's undergoing puberty, because of the hormonal surge, you'll see that there's exaggerated inflammation, bleeding and swelling. So that is a difference.
Now, doctor, can you speak about the chance of gum infections during pregnancy?
So pregnancy, what happens is that one thing what I want to tell people who are planning for a pregnancy or going through pregnancy, the gum health is very, very important. If they are planning for a pregnancy, they should always prioritize seeing a dentist to see if they're not only gums, everything, if oral health is in perfect situation or not. What happens if they neglect it? Same thing, what happens in puberty, same thing happens in a pregnancy also. There's a hormonal imbalance, there is hormonal excess surge of hormone, excess level of production of the hormones in the body. These hormones definitely, what they do is increase the blood supply to the gum tissues, make them very sensitive, and the gums can be easily swollen. There will be hyperinflammation, exaggerated inflammatory response, exaggerated response to the bacterial products, and sometimes these pregnant people can develop gum swellings also.
Gum infection in pregnancy increase the risk of premature birth and low birth weight in babies.
Yeah. So studies have found this is one of the significant association or link that studies have found between the oral infection or gum disease and the preterm low birth weight infants. Now, how does a gum disease cause such a big thing? Whenever a gum infection is there for a long time in the mouth, as I told earlier, there will be inflammatory mediators that will be entering the circulation. So there are a particular set of inflammatory mediators called as prostaglandins. So when a woman is undergoing pregnancy and has an associated gum infection, these inflammatory mediators called as prostaglandins, when the level or the load of this prostaglandin increases, they can stimulate contraction of the uterus and cause premature labor. So when a premature labor happens, the baby born can be having an underweight. So this is one of the significant associations, one of the complications that is associated with a gum disease for a pregnant patient. So it is very, very important that if a woman is planning pregnancy or going through pregnancy, get your oral screening done, get your gum infections treated so that you can have a very safe pregnancy and give birth to healthy babies.
Doctor, coming to another stage, the postmenopausal stage in women. Do the hormone changes they undergo causes this gum infection?
Gum infection anybody can develop. In postmenopausal women, what happens is that as we know, the estrogen level drops. Now studies have shown that with the drop in estrogen levels, calcium can leach out from the bones, leading to the decrease in bone density, which we call as osteoporosis. Now osteoporosis, what does it do? It weakens the bone. So even the jaw bones are weak. So when a gum infection is there in postmenopausal women, it can easily damage the weakened bone. So there will be faster bone destruction, there will be faster loosening of the teeth, and there will be easy loss of tooth in postmenopausal women. So it is important, people who are undergoing menopause, definitely they should prioritize their gum health and get their gum infections treated so that they don't lose their bone, jawbone, and don't lose their teeth.
And doctor, what advice do we have to give to our viewers regarding gum health?
So the most important thing is oral health is oral health and your general health are not separate. You have to combine both. Oral health is a part of your overall well-being. And a request to the physician is that please refer all the diabetic patients and women who are undergoing pregnancy, please refer them to a dentist or a periodontist so that oral screening, gum screening can be done and proper treatment can be delivered in time so that they don't develop any further complications and so that they don't lose their teeth.
And finally, doctor, what do you have to say about Al-Hilal Healthcare Service?
Al-Hilal Healthcare Services, I would like to say that it is one of the best services in the Kingdom of Bahrain. I would request people to please visit us and utilize the services, the premium services that we are giving. We have best of the best doctors, all specialties are available. Please come and utilize the services that are available with us. Thank you.
Thank you, doctor. Thank you very much for this wonderful session.
Thank you,
about the gum health and giving us a lot of valuable information.
Thank you very much, thank you for having me here.
So viewers, as doctor said, prevention is always better than cure. Take care of your teeth. Stay happy, stay healthy, keep smiling. Till we meet again next time with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.